under item 3. Before I turn the floor over to the Secretariat to manage this session, I thought I should explain why I'm insisting that we try and limit our statements to the time limits previously agreed. So far, we have heard quite a number of delegations submit their interventions on a subject that is of paramount concern to the international community. But just for the information of delegations, I would like to advise you that we still have 75 speakers on the list. Having said that, I would implore delegations to adhere to the time limit of 2 minutes for national statements. I do appreciate and understand that this is an historic session, and you want to be able to let the international community know your national concerns. But we have an aggressive agenda, and if we are to finish in the time limit, I really need the understanding and cooperation of the remaining speakers. I will now turn the session over to the Secretariat.
Thank you, Madam President. I will now read out the names of the 5 member states to speak next. Turkmenistan, followed by Slovakia, Austria, Mali, and Timor-Leste. We would like to invite Turkmenistan, followed by Slovakia. Excellency, you have the floor.
Distinguished President, we thank you for giving us the floor and this opportunity to express our position. Turkmenistan has a strategic program and it supports the decisions of the WHO on UHC. We are convinced that in order to achieve success in UHC, that there need to be efforts from all parts of society. The government of Turkmenistan, led by His Excellency the President, has taken a number of measures, including setting up control on our borders. In order to protect our country and prevent the spread of the virus, we've taken a number of steps. We have created an emergency council, and on the 20th of January, the Cabinet of Ministers convened an urgent meeting, created an emergency pandemic commission, which was composed of all of the members of different government agencies. At that meeting, what was discussed was the prevention of the spread and introduction of the virus. An interagency plan was developed to prevent the introduction and spread of the virus, COVID-19. The interpreter apologizes, this is not audible.
Что касается стратегии безопасного ослабления ограничений и поэтапного изменения ограничительных мер, Туркменистан планирует действовать учитывая экстремальную ситуацию и опыт других стран. И пока все выведенные ограничительные меры продолжают действовать. Кроме этого, я хотел бы отметить инициативу президента Туркменистана выдвинуты на недавно проходившем онлайн-саммите глав государств и правительств движения и присоединения, по которым уважаемый президент обратил огромное внимание широкую применение механизмов научной дипломатии в борьбе с пандемией и ее последствиями, а именно тесному взаимодействию между профессиональным обменом опытом, знаний и информацией по методам лечения и профилактики заболеваний, медицинским препаратам и оборудованием, средствам индивидуальной защиты. В этом концепте является предложение
Excellency, my apologies. Excellency, the audio quality is a bit too bad for us to be able to interpret what is being said, so we'll need to come back to you in a moment when we have better audio connection. So we'll have to move to the next country, and we'll come back to Turkmenistan in a minute. Thank you, Excellency. We'll move to the next country because the audio was not good enough for us to be able to interpret what was being said. We'll come back to you in a minute. I now would like to invite Slovakia to be followed again by Turkmenistan. So Slovakia, Excellency, you have the floor.
Honorable Chair, distinguished Director General, colleagues. Slovakia aligns itself with the EU statement and EU co-sponsorship of draft resolution on COVID-19 response. Let me start by saying that the global reach of the novel coronavirus has been showing us that although we may have faced numerous challenges in the past, this one is indeed different. It is also important to stress that meanwhile our focus is set on the general population, the vulnerable and marginalized groups should not be placed under the radar and deserves our undivided attention. Furthermore, the appropriate attention should be also drawn to the fact that once the vaccine against COVID-19 is released for the treatment use, the international community should make sure it will not be commercialized in the first place, but rather it should represent an instrument for the general good. At international level, Slovakia considers the best practice and information sharing as a key tool for managing the pandemic efficiently. We have observed that deaths reporting due to COVID-19 varies significantly, creating hidden asymmetrical picture about the country's data statistics. Therefore, we would invite the WHO to provide a guidance on data collection and their reporting in order to ensure reliable international comparison. Slovakia widely supports the global efforts to tackle the novel coronavirus, and I wish to reiterate the firm commitment of my country to work with the WHO, the states all over the world, and other relevant partners in the spirit of global solidarity. Thank you very much.
Thank you, Minister. We would like to invite again Turkmenistan. That will be followed by Albania. Excellency, you have the floor again.
Distinguished President, thank you for giving me the floor. We would like to express our appreciation to the WHO. No, it's inaudible. The interpreter apologizes.
Мы начали предпринимать профилактические меры по защите территории нашей страны от распространения инфекции. На государственных границах усилен санитарный карантин надзор. На уровне Кабинета министров Туркменистана было создано и проведено заседание чрезвычайной противоэпидемической комиссии, в состав которой входит все министерства и ведомства стран. Задействованы меры реагирования и возникновения чрезвычайной ситуации в стране. Разработан межведомственный план по предотвращению завода и распространению нового коронавируса COVID-19, усиление противоэпидемических мероприятий, а также усиление работы с рестрикцией условий населения, по пропаганде выполнения правил личной гигиены и ведения здорового образа жизни. Создан запас противовирусных лекарственных средств и системы для диагностики COVID-19, консультантов, средств индивидуальной защиты и другие. Совместно с ВОЗом разработан проект плана обеспечения готовности реагирования Туркменистана на случай коронавируса COVID-19. Что касается стратегии безопасного отступления ограничений и поэтапного изменения ограничительных мер, Туркменистан планирует действовать, учитывая эпидемиологическую ситуацию и опыт других стран. И пока все выведенные ограничительные меры продолжают действовать. Кроме этого, я хотел бы отметить инициативу президента Туркменистана, выдвинутую на недавно проходившем онлайн-саммите глав государства и правительства движения непросветления, по которому уважаемый президент Туркменистана обратил огромное внимание широкому применению механизма научной дипломатии в борьбе с пандемией и в ее последствия, а именно тесто взаимодействия между профессиональными, обмен опытом, знаниями и информацией по методам лечения профилактики заболеваний, медицинских препаратами и оборудованием, средствами индивидуальной защиты. В этом контексте весьма актуально является предложение туркменского лидера о создании международного совета ученых-медиков. Это, прежде всего, налаживание необходимых в данный момент нормальной связи между передовыми учреждениями здравоохранения и медицинскими центрами. Исключение искусственной изоляции жизненных важных, которые могут быть использованы для элиминации пандемии. Мы выражаем глубокое сотрудничество ВОЗом по вопросу внедрения требований международных и укрепления потенциала в области готовности и реагирования системы общественного здравоохранения Туркменистана. По всему спектру возникающий сейчас вопрос требует усиления координации роль ВОЗа и ООН. Еще раз хотел бы подчеркнуть полное нашей страны, деятельность ВОЗа и поблагодарить руководство ВОЗа и сотрудников этой организации и их профессиональной работы. Благодарю за внимание.
Thank you, Minister. I now invite Austria to be followed by Mali. Excellency, you have the floor.
Ministers, Excellencies, Austria fully aligns with the statement of the European Union and its member states. Our crisis management fights primarily a virus, SARS-CoV-2. Many of us are quite successful in implementing our containment programs. But we have to focus also simultaneously on the support of our economies, labor markets, reopening schools and universities, international travel and tourism. Austria is now in the phase of adaptive recovery, going forward in 2-week steps. We started in mid-April by opening all stores and services, and by the end of May, we will back to be normal life. In Austria alone, the economic impact of this pandemic crisis is enormous. We might end up with a minus of 7.5% in GDP in 2020. From WHO as a supreme technical health authority, we expect objective technical guidance in many of these areas. This pandemic is not alone about health. We, who are very early in this, have to develop all right measures for this adaptive recovery instantaneous without being able to look at many good practices. Another global concern we want to share. We all should consider future COVID-19 medical treatments and vaccinations as a global public good, accessible to all member states at a reasonable price. WHO in this regard has also to play an important role to facilitate solutions regarding intellectual property rights. Austria has shown international solidarity by pledging 31 million euros at the Coronavirus Global Response International Pledging Event recently hosted by the European Commission. On behalf of Austria, I would like to thank WHO and the Director General for their leadership and their excellent work. Dr. Tedros, we trust in you and WHO.
Thank you, Minister. I now give the floor to Mali, followed by Egypt. Excellency, you have the floor. Mali, please turn on your sound so that we can hear you. Okay, we'll come back to you a bit later, Mali. I will now give the floor to Timor-Leste. Timor-Leste, you have the floor. We'll also come back to Timor-Leste. I will now give the floor to Egypt. Egypt, you have the floor. Okay, we'll come back to Mali, Timor-Leste, and Egypt a bit later. I will now give the floor to Sierra Leone. Sierra Leone, you have the floor. So as we're trying to resolve some communication problems, or some connection problems rather, we will now go to Spain. Spain, you have the floor.
España agradece al director general su intervención e informe.
Spain thanks the DG for his statement on the work done by the organization, particularly regarding the pandemic, as well as the WHO's efforts to give help to countries. In this regard, Spain would like to highlight the close relationship that WHO has had in supporting our country's work in fighting against the pandemic. We would like to say how important it is for the organization to be recognized and to avoid overlap and duplicities, and we trust that the WHO will continue to play a leadership role on the international level by listening to member states and being able to effectively and efficiently respond. Spain supports the WHO in its role of bearing the standard of the multi-sectoral approach to health. This is the time to show that the future can only be dealt with as a shared challenge, but while bearing in mind the gender dimension and how to raise awareness among citizens. We must put robust cooperation and information mechanisms in place. Let us form permanent links between science and political decisions and other areas of society. Universal health care, now more than ever, is the cornerstone in order to have efficient, resilient healthcare systems. Let us strengthen public healthcare systems which would be focused on primary care and patients. Let us achieve the goals in the Sustainable Development Agenda. Let us strengthen international cooperation, better access to vaccines, medications, diagnosis tests, and science for COVID-19. We support the ACT Accelerator Initiative coordinated by the WHO. Spain trusts and calls upon other member states to help strengthen consensus and multilateralism represented by the United Nations, with the WHO playing a central role. We would therefore like to say that we would like this 73rd World Health Assembly to culminate with a consensus resolution on the response to SARS-CoV-2. We need a new global world agreement in health in order to strengthen national capacities given pandemics. Let us push for access to water, sanitation, healthcare at work, and the fight against climate change, and for renewable energy. Thank you.
Thank you, Minister. I now give the floor to Cook Islands, to be followed by Marshall Islands. Cook Islands, you have the floor.
Excellencies, ladies and gentlemen, kia orana. Today we come together as one, as health leaders representing health systems around the world. Let us use this opportunity, even for just a brief moment in time, to coordinate our efforts against COVID-19 in unity. On behalf of the Cook Islands government, I extend our prayers and sincerest condolences to those who have lost lives and livelihoods from this devastating pandemic, COVID-19. The Cook Islands is one of a few countries that remains COVID-19 free. This was a result of our early national health emergency response and the mobilization of our communities to implement critical public health measures. Our health system has been reoriented to optimize universal health coverage and to focus on primary care and preventative community-based health services. This is designed to enable rapid detection of COVID-19 and activation of contact tracing, as well as address the burden of NCDs. The social and economic impact has been severe for many countries, the Cook Islands included. We are progressing economic recovery measures that promote climate change mitigating initiatives and the protection of our social and physical environment. Strategies to safely ease border restrictions are requiring transnational conversations to ensure we protect both our population and those beyond our borders. We are adapting to our new norm and the new opportunities that have risen to provide quality, equitable health services. Finally, I wish to thank WHO, SPC, the New Zealand and Australian governments, and other development partners for assisting the Cook Islands in our national response. We are in this together, so no one gets left behind. Kia orana e kia manuia.
Thank you, Minister. I now give the floor to the Marshall Islands, to be followed by Uruguay. Marshall Islands, you have the floor.
Excellencies, Mr. President, Dr. Director General, Yahweh and greetings from the Republic of the Marshall Islands. The Marshall Islands fully supports the Pacific Islands statement delivered by the government of Nauru. Mr. President, my country remains one of the very few nations that remain COVID-free due to our collective efforts and early interventions. We are still undertaking measures to strengthen our health infrastructure. We sincerely thank our partners for their support, but much more is needed. We encourage the WHO and the international system to continue to strengthen its specific approaches on public health responses. Mr. President, the Marshall Islands joins other nations calling for an objective and independent investigation into actions around the early COVID-19 international response. It is very important that timely and transparent information be shared. Mr. President, the Marshall Islands also joins other nations calling for Taiwan's participation at the WHA and the WHO activities, ending unfair treatment which has endangered global health. Without active WHO participation, the Republic of China, Taiwan, risks becoming a cat in our global health system, despite strong efforts and generous contributions for other countries, including mine, to preventing and containing COVID-19. Mr. President, Republic of China, Taiwan has proven again to be a valued partner to countries in need, including my own. With experiences from coronavirus, all countries, including Republic of China, Taiwan, should collaborate and cooperate for a healthier future. Thank you, and Kamoltata.
Thank you, Minister. I now give the floor to Uruguay, to be followed by Ecuador. Uruguay, you have the floor.
From Montevideo, Uruguay, and the Public Health Ministry, we are pleased to submit to you a report on our action to deal with the COVID-19 epidemic. Firstly, we have carried out a public awareness campaign on coronavirus in order to disseminate all of the information we had on early detection. We designed a mobile phone application which guides users to different levels of complexity in order to get in contact with the user. We have also placed focus on primary attention at home, primary care at home, without having to go to hospitals. We scheduled surgery and medical appointments that were rescheduled in order to free up ICU beds. From the first day when there was a diagnosis, we made a statement on the national health emergency. We ensured access for the population. We created protection standards for health professionals. We practiced isolation. We closed borders. We anticipated and duplicated the number of flu vaccines. We promoted the use of masks. There was a campaign to prevent negative psychosocial effects, and we created a national healthcare map in order to ensure that we would have all of the necessary experts, and we put all of the necessary human resources in place. We also worked on the back lines in order to ensure that all of the ICU equipment necessary was available, as well as the research lines in the plasma bank and preventative treatment. We also pushed forward public-private partnerships in order to respond to the crisis. We developed a contingency center and also a convalescence center specifically for COVID care. We have a number of protocols in place for multiple sectors in order to deal with the issue from a multidisciplinary social, economic, and epidemiological perspective to ensure primary, secondary, and tertiary care. Furthermore, we have organized the repatriation of citizens abroad. Humanism and quality of care continue to be at the heart of our priorities. Thank you.
Thank you, Minister. I now give the floor to Ecuador, to be followed by Vietnam. Ecuador, you have the floor.
Señora Presidenta.
Madam President, Director General, ministers, distinguished leaders, colleagues, it is an honor for me to address the World Health Assembly once again as a representative of the government of Ecuador. After thousands of cases and deaths, the COVID-19 pandemic has pressured global health systems in an unprecedented fashion, and particularly developing countries. In this regard, the multiple challenges posed by this crisis compel us to call into question basic aspects of our healthcare system, such as access for priority groups, supply chains, and fair access to medical products, scientific research, and the value of coordination between local and national governments. All of this with a primary healthcare focus. This requires some new thought. We cannot return to what we have done before. What this crisis has shown is that joint efforts on the national, regional, sub-regional, and global levels should be considered pillars for a sustainable development infrastructure. So concrete actions will be necessary in order to deal with the specific challenges posed to public health. In this regard, we would promote focusing on health and recovery on every possible level. But we think that this requires the inclusion of all actors and to create spaces for social participation so that all areas of society can recognize caretaking of health as something that is of all of our responsibility under the aegis of the public health authorities. In this regard, we would like to thank the EU for its initiative, and that we will support it in order to implement responses to the pandemic, including the mobilization of resources to that end. Furthermore, we would like to join the proposal put forward by Costa Rica regarding a repository of knowledge for the for health in order to push forward science, technology, and to engage in benefit sharing for scientific research and its implementation. We would encourage states, the academy, the private sector, research centers, and cooperation centers, among others, to join this call for action in order to face this pandemic together through solidarity with the conviction that healthcare and health actually are a global asset. Finally, we would like to support the United Nations in its response to the pandemic and would like to thank the WHO for its constant presence in facing this crisis in which humanity will prevail. And so we would like to call upon everyone, all of us, to continue working towards health. Unity, solidarity among states is what we need so that we can now walk the walk after talking the talk in order to ensure cooperation at every level in order to mitigate and contain the COVID-19 pandemic, as well as promoting health and priorities care for the most vulnerable. Thank you.
Thank you, Minister. Referring back to the words of Madam President, her guidance was 2 minutes per intervention, and we would appreciate if you could hold to that guidance, please. I now give the floor to Vietnam, to be followed by the United Arab Emirates. Vietnam, you have the floor.
Excellency President, dear Dr. Tedros, Director General of World Health Organization, Honorable Minister of Health Member State, distinguished delegates, ladies and gentlemen. Vietnam was one of the first countries affected by COVID-19 and recorded the first case on January 23rd of 2020. Up to now, 320 cases have been confirmed with no deaths, and 66 were imported cases. Among them, more than 80% cases had recovered. Ladies and gentlemen, in Vietnam, with strong political leadership, we undertook series of public health measures to fight epidemics. It's like fighting against the enemy. Immediate action has been done now in a resolute and coordinated manner and adjusted promptly if required. The National Steering Committee to combat COVID-19 has been set up at the early stage of the outbreak, with strong commitment from the whole system and multi-sectoral coordination for strategy include strictly prevention from outside, early detection inside, isolation treatment has been implemented effectively with engagement of the local authority to direct and mobilize all resources on site, including commands, force, means, and logistics. Today, Vietnam has managed to keep the situation under good control in the past 32 days. Vietnam has not recorded a new case in community. Vietnam, with our capacity, have actively shared information and experience of prevention control COVID-19 and provided transparency information to WHO and other countries through the IHR channel. Ladies and gentlemen, realizing that COVID-19 will stay with us for a long time, Vietnam calls for further dialogue and cooperation mechanism to respond to COVID-19 to review the core capacity of member states and required by the IHR, including policy, surveillance, risk assessment, laboratory, infection prevention and control, clinical management, risk communication and resources, so as to recommend those that should be continually strengthened in the coming time. Ladies and gentlemen, I would like to take this opportunity to convey thanks to the WHO and the international community for providing support and assistance to Vietnam as well as many other member states in their effort to fight against the pandemic. I wish you all good health. Thank you very much for your kind attention.
Thank you, Minister. I now give the floor to the United Arab Emirates, to be followed by Nepal. United Arab Emirates, you have the floor. We have trouble connecting to the United Arab Emirates. We'll come back to them later. I now give the floor to Nepal, to be followed by Guyana. Nepal, you have the floor.
Namaskar.
Mr. President of the Assembly, Mr. Director General of the WHO, distinguished dignitaries. In the context of COVID, we all are passing through a challenging time with many risks and uncertainties. On behalf of the Government of Nepal, I would like to express high appreciation and sincere gratitude to the frontline health workers for their untiring effort in COVID response. Diseases such as COVID have no boundaries. Neither they discriminate people based on color, class, and group. Hence, it is our collective responsibility to fully secure health rights of people across the globe. From the outset, Nepal has been responding to the COVID outbreak with high-level political commitment and mobilizing multi-sectoral mechanisms. While Nepal is institutionalizing federalism, the ongoing efforts to respond to this epidemic from the three tiers of government have been instrumental. In Nepal, number of infected people is in increasing trend. It is therefore the upcoming days can be further challenging for us. In addition, it has further emphasized the need for resilient and responsive health systems and sustained level of in-country production of medical goods and services. The effort on the COVID response from WHO and other national and international stakeholders have been commendable. It has further proved the historic role played by these organizations in protecting human health. I would like to emphasize the need for unified efforts by the member states for universal health security. Finally, I wish for the successful deliberation of this Assembly, which is being conducted with the use of available advanced technologies, despite several limitations. Thank you and namaskar.
Thank you, Minister. I now give the floor to Guyana, to be followed by Afghanistan. Not Cameroon, by Afghanistan. So Guyana, you have the floor, followed by Afghanistan.
Warm greetings from the government of the Cooperative Republic of Guyana and the Ministry of Public Health to all member states of the World Health Assembly. Guyana wishes to congratulate the WHO and the Secretariat for its stewardship over the past few months of the COVID-19 pandemic. For all countries, and especially for low and middle income countries, this stewardship has been priceless. Guyana calls for continuing the global solidarity and coordinated responses that will contribute to finding solutions soonest and thereby reduce the social and economic impacts and insecurity resulting from the pandemic. The importance of strengthening and expanding primary health care and routine immunizations should remain on the agenda as we work to prioritize prevention and preparedness at national and global levels to mitigate the effects of COVID-19 and future health challenges. Guyana wishes to underscore the need to speed up the development and production of treatments and vaccines, and to ensure equitable access and distribution in a timely manner as these become available. Finally, Guyana recognizes the importance of human resources and calls for greater investments in this area, especially in strengthening the capacity of our first responders. Guyana continues to strengthen its emergency response capacities across the country to mitigate the spread and effects of COVID-19 and reiterates its appreciation of WHO's coordination and global leadership to the pandemic. Thank you.
Thank you, Minister. I now give the floor to Afghanistan, to be followed by Iraq. Afghanistan, you have the floor.
Madam President, fighting against requires a coordination by regional and global. It is the time to further the HR plan from partners for effective management of public health emergencies. One of the major challenges is to maintain progress in the face of increasing instability, violence, and rising poverty. Maternal mortality remain unacceptably high. The coverage of population is suboptimal mainly areas. Both public and private health remain low. The country continues to suffer an increasing burden because of armed conflict, which contributes to the mass population displaced. Likewise, police has been facing numerous challenges, such as growing restrictions implementing house-to-house campaigns. The situation is being further worse due to the postponement of the vaccine campaign. Attack on healthcare providers and health facilities in Afghanistan continue to remain a major concern. I am sure you are aware of the recent attack on a maternity hospital in Kabul, which took the lives of many mothers. In this incident, we lost one brave midwife of who delivered critical health services. My thoughts and sympathy are with the families of the finally COVID-19 disproportionately and conflict zone, making them extremely vulnerable with now more than ever demands peace in the region. In order to overcome the challenges as a fragile and low-income country will count on your continued support during this difficult time. My last word for us, COVID-19 is not only a challenge, but an opportunity as well. It helps us detect our undetected capacity, resilience, and hope for goal and success. I thank you.
Thank you, Minister. I now give the floor to Iraq, to be followed by San Marino. Iraq, you have the floor. Iraq, it seems you are connected, but we can't hear you. Can you please turn on your microphone if it's muted? Iraq, you have the floor. Okay, we'll move on and we'll come back to Iraq later. I now give the floor to San Marino, to be followed by Namibia. San Marino, you have the floor.
Okay. Madam President, Mr. Director General, dear colleagues, my country has been dramatically affected by the coronavirus. When we registered the first case at the end of February, our only hospital had no isolation wards and only had 6 intensive care units. Now we have 80 beds in the isolation wards and 20 in the intensive care. On April 7, we began serological screening of the entire population, starting with the health workers and the police forces involved in the operation. Then moving on to the family of infected people, and finally we started screening workers. To date, our country has carried out almost 4,000 molecular swabs and more than 7,000 serological tests on its population, counting only 34,000 inhabitants, and on cross-border workers from neighboring Italy. The contagion in the family circles of those who have been sick is 15–20%, while in the rest of the population we register much lower percentages close to 1%. We are confident that the epidemiological investigation and the tests, which we intend to do on the entire population, will be of great help in understanding the phenomenon we are facing. This health crisis immediately turned into an economical crisis. The inability to have access to European funding exposes us to an unprecedented crisis. We therefore hope that channels of solidarity can be opened as soon as possible, including by the WHO, within which our country has largely contributed over the years in the coordination as co-leader of small countries. I would like to address my heartfelt thanks for his support, most of all to Mr. Kluge, WHO Regional Director. Thank you.
Thank you, Minister. I now give the floor to Namibia, to be followed by Sierra Leone. Namibia, you have the floor. Namibia, you have the floor.
The camera. Yeah.
We can hear you, Minister. Please go ahead, Excellency.
Thank you very much. The 7th session of the World Health Assembly is taking place at a time when the world is completely devastated. We express our most sincere and heartfelt condolences to the loved ones who have succumbed to COVID around the world. Further, I wish to commend the Director and the Secretariat for convening the meeting during this time. Your sterling work, the WHO excellent report to countries globally to respond to COVID-19 pandemic are truly commendable. Namibia calls for increased support to health, enable it to provide assistance, coordinate the distribution of commodities, as well as effectively response. We further urge that WHO be empowered by its member states to ensure that all technologies the pandemics are treated as public goods. Madam President, Namibia recorded positive cases on the 1st of March 2020. We have since recorded 16 cases, with the last case recorded on the 5th of April 2020. The majority of were imported, with 3 cases recorded as transmission. Out of the 16 cases, 13 have fully, but the past days with no new cases. We are fully aware we cannot relax our plan. We must continue to prevent the spread in our country. The risk of importation of virus in Namibia vehicular is one of the main. It is thus critical, stronger coordination and synchronization of intervention, especially for. I thank you.
Thank you, Minister. I now give the floor to Sierra Leone, to be followed by Nauru. Sierra Leone, you have the floor.
Yes, can you? Let me extend sincere greetings from His Excellency the President to the leadership of WHO. Let me also say that Sierra Leone was exposed to the Ebola scourge from 5 years back. That experience made us not a bit more prepared, but one that was ready for the challenge. This was led by His Excellency the President. All the basic tenets of hand washing, of social distance, of using the mask as well. All of that started very early in the year. And the National Policy Agency decided to create an autonomous entity described as the National Response Team to COVID-19. That team activated the 7 disease pillars, that of surveillance, laboratory, case management, food and nutrition, psychosocial, and quarantine. We set out to ensure that we screen those entering into the country. We also set out to quarantine those that have exposed to the disease or from countries that have registered more than 50 cases. We were, I would say, the last country to register the disease in West Africa. We had something like the first case coming up the 31st of March. Now it is with us. We expanded our testing. We did that with PCR fluorescence methodology. Currently, we have tested well over 4,000 people, but the positivity number is 519 as at today, the 18th of March. Of that number, 148 now left the hospital. We believe they are free of the disease. That indeed is a good mark, but we have lost 33. Of those, 17 happen to have occurred outside of the treatment center, reflecting some weakness in the health system. We've gone through the issues of closing down the country for 3 days. We have shut down schools, we've shut down churches, and nowadays, we now experience that we are getting other things coming up. Gender violence, rape, mental health issues. Well, it is clear to us that we will not have been able to attain as much as we have without the support of various agencies, Africa CDC, WHA, DACMA Foundation, the World Bank Global Fund, Islamic Development Bank as well. But it is clear to us that the intervention have to be health system strengthening. I thank you very much.
Thank you, Minister. I now give the floor to Nauru, to be followed by Mauritius. Nauru, you have the floor.
Nauru continues a strong push in preparedness and response against the introduction of coronavirus as multi-sectoral governments, private, donor support and regional technical advising work in collaboration. This is in close alignment with the Pacific Humanitarian Team COVID-19 Humanitarian Response Plan. Seeing how easily COVID-19 has overwhelmed the health systems of some of the countries with strong health sectors, Nauru has taken a strategic zero-tolerance approach of catch and contain, as we cannot afford local transmission that could overwhelm our resources. We have 2 levels of framework of phased strategic response plans under a current declared state of disaster. The first is a coordinated national all sectors response plan. The second is a health sector specific surge capacity to undertake the following steps, to mention a few. 1. Border health travel advisories and restrictions of direct entry. 2. Compulsory screening at our ports of entry. 3. Dedicated transition facilities to quarantine travelers for 14 days. 4. Ongoing set up a new state of CIATS CCU with 18 beds for confirmed coronavirus cases requiring hospitalization. 5. Rolling out of PCR testing. To close, COVID-19 pandemic remains one of the most challenging tasks we are dealing with, and Nauru acknowledges the continued support of our partners, especially Australia and the Republic of China, Taiwan. The success of the Republic of China, Taiwan in dealing with this crisis cannot be ignored. We need to harness inclusivity and global cooperation at this level more than ever to defeat this pandemic. Wishes to render its full support the draft resolution COVID-19 response. Thank you.
Thank you, Minister. I now give the floor to Mauritius, to be followed by Egypt. Mauritius, you have the floor.
3 seconds, maybe. 3.
Mauritius, you have the floor after the clapping by Nauru.
Director General, distinguished delegates, Madam President, allow me to congratulate you on your election as chairperson of the 73rd World Health Assembly. It gives me great pleasure to address you all. Mauritius aligns itself with the statement of the African group. Our first cases of COVID-19 in Mauritius date back to the 18th of March. Immediately, entry restrictions in the country were consolidated. Normal passenger flights were suspended. Our Prime Minister chairs the high-level committee on COVID-19, initiated a nationwide sanitary curfew as from the 20th March. These bold measures have proved to be capital in the ability to cut down the risk of a major outbreak. In all, we have registered 332 COVID-positive cases. We have sadly registered 10 deaths, and 322 have recovered. Sanitary curfew should remain in force till the 1st of June. However, essential activities have resumed fully. For the last 21 days, Mauritius has not registered any new COVID-19 positive case, but we continue to remain vigilant. Madam President, I thank the World Health Organization for its unflinching support. It should also be highlighted that developed and friendly countries help us by assisting our nation with donations and capacity building. The government of Mauritius has also worked relentlessly to get necessary medical equipment and medicine in a context where connectivity between nations remains challenging. I also pay tribute to the people of Mauritius and all our stakeholders who collaborated to stop the spread of the disease. Thank you very much.
Thank you, Minister. I now give the floor to Egypt, to be followed by Cabo Verde. Egypt, you have the floor.
يا رب ومسك عن تقدير الجهود الإنسانية التي قامت بها سكرتارية الموضوع العالمية بالتعاون مع الأعضاء.
The interpretation apologizes. The quality of sound is not sufficient to assist the translation or the interpretation process.
الإجابة العالمية لجائحة كوفيد-19 وحشد الدعم لجميع الدول للتعامل مع الأزمة الحادة التي تؤثر على الصحة العامة والأوضاع الاقتصادية والاجتماعية. كما نؤكد عزمنا مواصلة التعاون مع المنظمة ليتم كلها من القيام بدورها في هذا المجال على الوجه الأكمل. السيدة الرئيسة، لقد أكدت الأزمة الحالية الحاجة الماسة لتعديل الأولويات فيما يتعلق بالصحة العامة حول العالم، وأهمية الاستثمار في جوانب الوقاية والتأهب لمواجهة الأوبئة، فضلاً عن تعزيز الرعاية الصحية الأولية وتحقيق التغطية الصحية الشاملة، مع أهمية توجيه الجهود نحو دعم النظم الصحية في الدول منخفضة ومتوسطة الدخل، والتي تفتقد أغلبها للإمكانيات الأساسية اللازمة غيابة الأموال. ولا يفوتنا أن نشيد مجددا الجهود الضخمة التي تقوم بها المنظمة لتوفير الإمدادات والأدوات ووسائل الوقاية وأجهزة الكشف والتشخيص من خلال قيادات المبادرات الدولية في هذا الشأن، لا سيما محدودية هذه الأدوات لدى العديد من الدول النامية والأقل نمواً والعجز العالمي الحالي في سلاسل الإمداد والتمويل، علاوة على التأثير السلبي للإغلاق العام وبطء النقل الدولية. السيدة الرئيس، لقد قامت مصر منذ ظهور أول حالة إصابة في البلاد بواسطة أحد المسافرين باتباع عملية مجتمعة للرصد المبكر والتقصي والتتبع والعزل والحفظ الصحي في كافة محافظات الجمهورية ونقاط الدخول المختلفة للسيطرة على انتشار الفيروس، وذلك في إطار خطة تأهب متعددة القطاعات ضمن جميع الوزارات المعنية تحت إشراف مباشر من السيد الرئيس عبد الفتاح السيسي، جنبا إلى جنب مع وضع حزمة من التدابير والإجراءات الخاصة بتخفيف آثار انتشار الفيروس على الأوضاع الاقتصادية والاجتماعية من دعم الفئات التي تضررت من جراء ذلك المالي، خاصة التي تعتمد على كسب أرزاقها بشكل يومي. لم تقتصر جهود الحكومة المصرية على مكافحة الفيروس على المستوى الوطني، ولكن كذلك كانت على مستوى القارة الأفريقية في إطار ثوابت السياسة الخارجية المصرية تجاه القارة وشعوبها. في النهاية تتطلع مصر لاستمرار التضامن والتعاون الدولي للقضاء على الفيروس في إطار النظام الدولي متعدد الأطراف تحت قيادة منظمة الصحة العالمية، ونشدد على ضرورة المنظمة والمجتمع الدولي جهود إنتاج وتوفير تكنولوجيا الصحة العامة والأدوية واللقاحات وتوزيعها بشكل عاجل وعادل ومنصف على جميع الشعوب وإزالة أي عوائق التحويل دون تحقيق ذلك. شكرا لسيادتك.
Thank you.
شكرا السيدة الوزيرة. الآن أعطي الكلمة لجزر الرأس الأخضر ثم بليز.
Cabo Verde, you are connected.
جزر الرأس الأخضر، هل لكم أن تشغل الميكروفون؟ السيدة الرئيسة.
Nous adressons à la présidence de la 63e Assemblée nationale vos succès dans la conduite des travaux et d'excellents résultats. Au directeur général de l'OMS, notre reconnaissance, son orientation sage et décisive à une époque de grandes réformes.
The interpreter apologizes, but it is impossible to interpret due to the low quality of sound.
Excellency, apologies. We have some interpretation issues. Can I ask you to start again slowly so that the sound quality can come through a little bit better for us? Apologies. Please start again. Thank you.
Okay. Monsieur le Président.
President, Director General, on behalf of the government of Cabo Verde, we would like to express to the 73rd World Health Assembly every success in its work, as well as excellent results. To the Director General, Mr. Tedros, we would like to express our recognition in such a difficult period and time. This pandemic has had a serious impact on our societies. Without a vaccine, it is not possible to overcome this pandemic. Despite the efforts made and the huge number of infections and deaths, we unfortunately cannot end the crisis, especially since the pandemic will have an effect on all sectors of society and will also prevent us from treating other chronic non-transmissible diseases, oncological diseases and yellow fever and others. Madam President, Cabo Verde is part of the African small island states with a population of just above 500,000. It is facing 3 consecutive years of drought. This poses additional challenges for health security and water provision for the population. Without natural resources, Cabo Verde's tourist sector is the main driver of economic development. Until the pandemic, the country received 1 million tourists per year. Only 3 of the 6 islands making up the archipelago have registered cases, namely 326 confirmed cases. 67 persons have recovered, and sadly there have been 3 deaths. The infection remains active and is spreading only in Santiago and in particular in Praia, the capital of the country, with about 78% of registered cases. Madam President, the paralysis of the tourist sector, the lack of diversification of the economy have a direct impact on resources which are crucial for the management of the country. As a direct consequence of COVID-19, the budgetary deficit will increase from 3% to more than 10% of the GDP in 2020. My country, as other small island developing states, is concerned about the increasingly limited access to international markets and the reduced international financial support, as well as the high level of debt, 120% of GDP.
You have run short on time, unfortunately, and we have to move forward. So on behalf of Madam President, I will be moving forward with the next intervention by Belize, to be followed by Cameroon. Belize, you have the floor.
Belize conveys congratulations to the Bahamas in assuming the presidency of this assembly, as well as to the Director General, whose resolute leadership is steering us through unprecedented times. No country has been spared as the COVID-19 pandemic damages health systems, economies, and livelihoods around the world. Belize mounted an early all-of-government and all-of-society response, based much on public health advice from the WHO, of regional organizations, and of regional friends such as the Republic of Cuba. Belize has only had 18 cases, 2 unfortunate deaths, and 16 cases now have fully recovered. Today, Belize is one of the few countries in the world that is currently free of COVID-19. More than ever, we need an enhanced all-world response to maintain global supply chains for effective surveillance and for equitable, affordable access to medical supplies, including for a vaccine. In Belize, as everywhere, the pandemic also compels us to redouble our efforts to combat the global epidemic of NDCs and to maintain climate change goals high on our collective agenda. My delegation holds the position that Taiwan's exclusion from the World Health Organization represents a break in the global health system that can undermine the Taiwan has lessons to share from its COVID-19 success. Belize again calls for Taiwan's meaningful participation in the World Health Organization and for its observer status in World Health Assemblies. Finally, Belize joins in saluting our health workers around the world, and we reaffirm our strong support for the UN system and for the WHO in the continued coordination of a comprehensive multilateral response to the pandemic. Thank you.
Thank you, Minister. I now give the floor to Cameroon for a group statement on behalf of the African Group of Ambassadors, to be followed by Iraq. Cameroon, you have the floor.
Madame Présidente,
Cameroon, we seem to have lost you. Are you there? Please start again. Okay, we'll come back to Cameroon in a little while. I'll now move to Iraq, followed by St. Lucia. Iraq, you have the floor. Okay, so we'll come back to Iraq. There you go. Iraq, if you can hear me, please, you can start your statement. Thank you. No? Okay, so Iraq a bit later. I now give the floor to St. Lucia. St. Lucia, you have the floor.
Mary Isaac,
I now
Minister
give the floor
for Health
to
and
St.
Wellness,
Lucia.
St. Lucia.
St. Lucia,
The government
you have
and
the floor.
people of St. Lucia would like to thank all agencies who have assisted us in combating the novel coronavirus. When WHO advised all countries to ensure preparation for containment as a result of the dreaded coronavirus, the Department of Health and Wellness in St. Lucia prepared for the worst-case scenario and immediately sensitized key stakeholders and the public to ensure early detection and efficient management of COVID-19. To facilitate quarantine and isolation of persons identified through contact tracing and those returning from high-risk COVID-19 areas, 5 public health facilities were established in hotels, and a hospital
I now give the floor to St. Lucia. St. Lucia.
To date, 900 persons have undergone quarantine. All agencies. We have had 18 positive cases of COVID-19 in St. Lucia, 2 of whom were repatriated. When WHO advised all countries to ensure preparation for containment, as a result of the second time during this pandemic that the Department of Health and Wellness in St. Lucia prepared for the worst-case COVID-19 and immediately sensitized the government and people of Taiwan were instrumental in donating thousands of medical masks to St. Lucia. In April 2020. To facilitate quarantine and isolation, we applaud the ability of Taiwan to contribute thousands more to the United States, from high-risk United Nations territories and member states. 5 public health facilities were established in hotels, Latin American countries.
I now give the floor to St. Lucia. St. Lucia.
It is important to note that as of April 29, we have had 18 positive cases of COVID-19 in St. Lucia, whom were repatriated. When WHO advised all countries.
St. Lucia, apologies. There seem to be some technical issues there. We will replay in a minute. We will now move to Iraq. Iraq, I hope you can hear us. You have the floor. Okay, we'll move on and go to, now we'll go to Guatemala to be followed by St. Vincent and Grenadines. Guatemala, you have the floor.
Señor director, ministro, señora presidenta, diputado de la República, el doctor Alejandro, senador y con su conocimiento, articuló todas las capacidades, seguridad, dando con esto y mitigación para la población y resguardar el conflicto. En esta lucha nos enfrentamos mundial de acción personal, el valioso la organización y a la organización de las para continuar mediante así también incluir a todas las la lucha contra el mal, así como destacando la valiosa de China a desarrollar tanto en la situación pero yo mi país como la asamblea así como la y actividades Guatemala ha recibido ante esta generada consideramos aliados en materia de solidaridad. Quiero hacer a todos y a los organismos que nos han. Gracias, señor. Muchas gracias.
Thank you, Minister. I now give the floor to St. Vincent and Grenadines to be followed by Rwanda. St. Vincent and Grenadines, you have the floor. St. Vincent and Grenadines, you have the floor. You're connected. You can start your statement now. Thank you. Please proceed, Minister. You have the floor. Apologies, you're still muted. We cannot hear you. Okay, we'll have to come back to you. Let's move to Rwanda. Rwanda, you have the floor.
Madam Chair, Director of WHO, distinguished delegate, good evening. First of all, I would want to express my condolence to families who lost their loved one with COVID-19. The government of Rwanda is pleased to participate in this 73rd WHO Assembly. Indeed, it is an opportunity to deliberate on the issue distressing our health systems, especially at this critical time of COVID-19. This situation is a wake-up call to the world to realize that it is inevitable to invest in our health sector than never before. Rwanda considers the primary health care approach as one of the most vehicles for achieving universal coverage. Through this approach, Rwanda reinforced a people-centered, integrated, and sustainable health care in order to ensure quality, essential health care service as close as possible to the community. In order to meet this obligation, we must hold ourselves answerable to providing equitable, affordable care services for our people. We must promote and support values of efficiency, accountability in order to achieve sustainable and resilient health systems. In time like this, where the whole world is struggling to overcome COVID-19, it is imperative to have a global solidarity and collaboration to strengthen partnership in sharing information and expertise that will aid government to make informed decisions to contain COVID-19. Rwanda will continue to build a resilient health system that is adaptive to changes, new demands, and new stressors such as COVID-19, Ebola, and other epidemic emergencies. It is therefore important to maximize community engagement, respond to health issues, adopt healthy behavior and lifestyle, and conduct regular wide consultation with all stakeholders. Allow me, Madam Chair, to conclude by commending the work, effort, and courage expressed by WHO leadership at all levels during this COVID-19 multi-sectoral crisis. We are more than grateful for all your help and sacrifice in fighting this unseen enemy, and we honor your dedication to save lives. Thank you so much.
Thank you, Minister. I now invite Burkina Faso to the floor, to be followed by Iraq. Burkina Faso, you have the floor.
Monsieur le Président, Mesdames et Messieurs.
Chair, ladies and gentlemen, it is an honor to take the floor on behalf of Burkina Faso in this distinguished assembly, which is meeting in unusual circumstances imposed by the COVID-19 crisis. I would like to, on behalf of the government of Burkina Faso and in my own behalf, congratulate the president of the 73rd WHA for her election, as well as Mr. Tedros Adhanom Ghebreyesus, WHO DG, for his tireless efforts to improve health. President, ladies and gentlemen, Burkina Faso, just as other countries in the world, is facing the health crisis caused by COVID-19, whose side effects are having a horrible impact on its development. This crisis is worsened by a harrowing security backdrop, which compels us to deal with the resilience of our healthcare systems. Indeed, just as many other countries, preparedness for pandemic response of COVID-19, which is the main subject of this session, is particularly relevant for Burkina Faso. This is why my country is committed to benefit from the proposals of resolutions which will come from this assembly in order to respond to COVID-19. I would like to finish by calling upon international solidarity and cooperation in order to end this pandemic as soon as possible. Thank you very much. Thank you, Madam Minister.
The floor to Iraq, to be followed by Cameroon. Iraq, you have the floor. Okay, so Iraq will need to come back to you. I will now move forward and invite Cameroon to the floor for the regional statement. Cameroon, you have the floor. Minister, Cameroon, we cannot hear you. Please try again. I'm sorry, apologies, we still have no sound. We'll have to come back to you yet again. I will move forward and invite Nicaragua to the floor to be followed by Libya. Nicaragua, you have the floor. Nicaragua, you have the floor. Please proceed. Nicaragua, unfortunately we can't hear you. Could you kindly check sound on your end and then please proceed? Apologies, Nicaragua, we're having some issues, so we'll come back to Iraq, Cameroon, and Nicaragua later. We will now give the floor to the Czech Republic. Czech Republic, you have the floor.
President, Director General, distinguished delegates, ladies and gentlemen, the Czech Republic fully aligns itself with the statement of Croatia delivered on behalf of the European Union. More than ever, it is an honor to have this opportunity to address the World Health Assembly. This very difficult year is designed the International Year of the Nurse and the Midwife. This is the reason why I would like to start by expressing my personal and sincere gratitude for their tireless efforts and work during days and nights in taking care for COVID-19 patients around the world. After years of paying attention to NCDs, now we have been reminded that infectious disease outbreaks and epidemics represent a significant health threat. COVID-19 took the international community by surprise. To avoid the most of these surprises as possible for future, I stress the importance of independent and comprehensive evaluation of the WHO and international community reaction on COVID-19 pandemic outbreak. Since building resilience at all levels is a key factor in preventing disease, protecting and promoting health in everyday life of each community, the Czech Republic continues to support health systems and fight against diseases around the world as part of its bilateral development assistance and its multilateral cooperation. I would like to make an appeal to political representatives and the WHO not to turn away from the principles of solidarity. The international community should reiterate its commitment included in the SDGs to leave no one behind. Each and every country in the world has to be provided by the adequate support. We must continue to share our experience with everybody who is interested and to learn from all those who have expertise. I believe the WHO should serve as a platform for this exchange. Thank you very much for your attention.
Thank you, Minister. I now give the floor to Hungary, to be followed by Greece. Hungary, you have the floor.
Dear Director General, dear ministers, ladies and gentlemen, it is my great honor to share this meeting with you, and I fully appreciate that the WHO brought this together under the scope of COVID pandemic. We also appreciate the WHO effort to help us all to control the spread of this disease. And we also appreciate the WHO Solidarity Trial. Here in Hungary, we started our preparation at the end of January when the first case appeared in Europe. We took the threat of the disease very seriously and we acted upon it. We wanted to save lives, we wanted to prevent healthcare from overpressure, and also we wanted to flatten the curve to enable the country to return to normal everyday life as soon as possible. Now, at the beginning of May, we're happy to say that yes, it is indeed what happened. We saved lives. The healthcare is in operation. It had enough capacity, and the country is getting the doors open to new life. We do hope that during the summer we can prepare ourselves for the coming fall, and we rely on the solidarity, on the participation of the other countries as well. I hope that we can do it together, and here and now, thank you to all of you for making it a success of the human being. Thank you very much for your attention.
Thank you, Minister. I now give the floor to Greece, to be followed by Panama. Greece, you have the floor.
Dear President, dear Director General, Ministers, Excellencies, Greece fully supports the statement made by Croatia in the EU presidency on behalf of the EU and its member states. In the battle against the unprecedented pandemic of the coronavirus, we have joined forces with science, solidarity, philanthropy and patriotism being our weapons. In order to protect our fellow citizens, but above all the vulnerable groups, our success is primarily attributed to the excellent healthcare professionals of our national health system. To those everyday heroes, doctors, nurses, administrative and paramedical staff, and the personnel of the National Center of Emergency Assistance. The scientists and the staff of Hellenic National Public Health Organization, who successfully undertook the tracking of the first case. From the very beginning, we have been in continuous contact with the World Health Organization and the European Crisis Disease Center. We have designated 13 reference hospitals across the country. We have conducted more than 30 preparedness exercises under the coordination of the National Center of Emergency Assistance. We entrusted the experts and appointed a scientific committee of experts. The first case of coronavirus appeared in Greece on February 26th. On the same day, following an order from the Prime Minister, I announced the postponement of the carnival events, and on March 10th, the suspension of the operation of all educational facilities. On March 22, the Greece's Prime Minister Kyriakos Mitsotakis proceeded to a general lockdown. Our plan started from the intensive care units. We increased intensive care beds from 565 before the crisis to 1,017. Hirings. We have strengthened the NHS with more than 4,000 healthcare professionals. PPEs. We have organized an unprecedented supply bridge amid global dispute regarding the medical material. Donations. We have received donations of 865 organizations amounting to 89 million euros. As the pandemic is not over, I strongly believe that we have to act all together with solidarity. Solidarity is not just a word. It is a value, it is a principle that must govern the world, especially in times of unprecedented crisis. Under this light, Greece fully supports the resolution proposed by the EU on the COVID-19 response, hoping in a prompt, positive perspective concerning medicines and vaccines. I urge to support the health in all policy strategy in order to ensure that no one is left behind. Thank you very much for your attention.
Thank you, Your Excellency. Ahora invitamos a Panama. Distinguido Ministro.
We would now invite Panama to take the floor. Distinguished Minister, you have the floor.
Ministerio de Salud de Panamá y de la señora ministra Rosario Turner.
From the Ministry of Health and the Health Minister of Panama, we would like to issue a warm greeting to those participating in the World Health Assembly. We would like to not just offer our condolences for the loss of life throughout this pandemic, but also we would like to offer congratulations and words of support to all of the health professionals who are really going the extra mile in these trying times. Since March, Panama has reported its COVID-19 cases, and since then we have tried to take steps to control this pandemic. But beyond that, a long time beforehand, we had activated the epidemiological teams, and we have carried out a number of tasks that we have tirelessly been devoted to and have shown a great deal of responsibility and accountability as deserved by the Panamanian population. We would like to congratulate all of the countries that, like us, are working hard to control this pandemic. We are sure that solidarity and cooperation are major pillars in order to emerge from this pandemic. We would like to offer our gratitude for the ability to speak here today, and would like to specifically thank you on behalf of the Health Minister. Thank you for your statement. We invite Bolivia to take the floor. Bolivia. On behalf of our President, Janine Yanez Chavez, we would like to offer a warm greeting to all of those who are participating in the World Health Assembly. The World Health Organization, since it was created, has been the organization spearheading international efforts to protect health in order to ensure better standards of living for people throughout the world. In this opportunity, the 73rd World Health Assembly, we are cognizant of the value of the WHO in leading international efforts. We are all facing one of the worst pandemics that humanity has faced. thousands of people infected or died, and with enormous economic impacts. We have to develop the well-being of our own peoples, and what this crisis has shown us is that we need to ensure that there are accessible services at the disposal of the entire population. We support the WHO, who through its regional offices has tried to ensure a proper level of care for its peoples. Health is one of the driving forces for the well-being of people. Communities have to participate in a spirit of shared responsibility with authorities. We also recognize the labor undertaken by health professionals in order to fight COVID-19. We would like to pay a posthumous tribute to those who sacrificed their lives in this fight. We want a better world, and for this reason, we would call out to everyone to protect life and health. Thank you.
Nicaragua, to be followed by Libya. Your Excellency, you have the floor.
Thank you. Representatives receive a warm greeting from the people and government of Nicaragua as we continue the society, peace, and reconciliation. Private is always Nicaragua facing its sovereign right to make its own policy.
Your Excellency, I apologize. We have technical problems. We cannot hear you well. We propose to go further with Libya, and we will try to... Your Excellency? Your Excellency, I apologize. We have technical issues and we cannot hear you well. Let us continue with Libya, and we will come back to you while our colleagues work on the issue. Libya, you have the floor.
Okay. Thank you, Chair, Excellencies, colleagues. Libya aligns itself with the statement given by Tunisia on behalf of the Emir States. Libya supports the WHO efforts and guidance. We stand in solidarity, starting by giving our gratitude and support to all healthcare workers across the globe. As an identified high-risk country, we appreciate the assistance and cooperation of the WHO and member states to help Libya face its challenges. Libya faces a serious public health threat in the most challenging way. For our health system is not resilient, and although we are working closely with WHO on all measures to implement the pillars of COVID-19 strategic preparedness and response plan to mitigate the potential consequences of this pandemic, with good coordination to expand testing and tracing, to identify cases and strong measures for repatriated citizens. However, we have concerns for our healthcare system is burdened and stretched by the ongoing armed conflict, which has diminished the resources, especially in the most vulnerable areas, and left hundreds of thousands of civilians displaced and in dire situation where they have to choose between leaving their homes to run away from war, or staying at home to run away from COVID-19. Libya stands ready to strengthen its collaboration with WHO, its partners, and member states to speed the global recovery. In order for that to happen, for us to get back on track to the universal health coverage targets, we need to invest in strengthening health security and human rights in each and every country, as health is a core human right. Libya's health security will in turn impact directly the economic stability and prosperity of our neighboring countries in Africa and the region. The response to COVID-19 is an all or none that requires commitment, strong international cooperation, fairness, in order for us to save human lives and dignity. Thank you.
Thank you, Your Excellency. We will try Nicaragua again. Distinguished Minister, do you hear us? Let us also try Cameroon. Your Excellency, can you hear us? We will try connecting Sudan. Minister, you have the floor. We would like to invite the Dominican Republic. Your Excellency, you have the floor.
La pandemia del COVID-19 ha sido un gran...
The COVID-19 pandemic has been a challenge for all of humanity, a major challenge for health systems, communities, families, and governments. World leaders have done and are continuing to do everything possible for their countries to prevail in this global crisis. The Dominican Republic was no exception, and its economy and social life have been affected, as has its health system, with 12,000 cases and some 400 deaths in the 65 and older population. We have been able to ensure that 40% of the hospital beds were available in order to ensure that the system would remain balanced. The Dominican Republic needs to strengthen its capacities in management, oversight, and mitigation of disasters, including through the use of technology in order to face these major challenges which are arising. Unity is key to fight this. All of us together, communities, governments, families, governments, and religious communities have the key in order to offer the response to this crisis. The WHO has offered a major services to our country, which we are very grateful for.
Japan, to be followed by Eswatini. Apologies. We will introduce Senegal first. Your Excellency, you have the floor. We would like to invite Eswatini to take the floor, to be followed by Mongolia. Your Excellency, you have the floor.
I have the honor to speak on behalf of the Kingdom of Eswatini on agenda item number 3. Recent years have seen a string of international outbreaks of emerging infectious diseases such as Ebola, Zika virus, and remember clearly the human toll of the 2003 severe acute respiratory syndrome SARS epidemic. Globalization has created a clear risk of the cross-border transmission of communicable diseases. With the rapid spread of coronavirus 2019 COVID-19 across the world, it is more imperative than ever to include all relevant parties and stakeholders in combating this pandemic. WHO's continued discriminatory treatment of Taiwan has seriously compromised the organization's overall disease prevention efforts and undermined the interests of its members and endangered global health. Without timely access to critical information about COVID-19, Taiwan risks becoming a gap in the global health system, which would undermine the very purpose of WHO's existence. It is worth noting that despite its proximity to the source of COVID-19, Taiwan has prevented a major outbreak. As of May 14, 2020, Taiwan had only 440 cases with minimal community spread in a population of 23 million people. Taiwan has effectively contained the spread of COVID-19 through the timely establishment of a transparent, centralized command structure, emergency measures such as border control, case identification and containment, and the regulation of medical masks and other medical resources to ensure their fair and appropriate distribution. Acting on the conviction that Taiwan can help, Taiwan has donated millions of medical masks to the United States, EU member states, and other European nations, diplomatic allies, countries in Latin America and the Caribbean, parties under the Taiwan's new southbound policy, and other friendly nations to help provide local medical personnel with more resources to fight COVID-19 pandemic. This clearly demonstrates that Taiwan, as a professional, pragmatic, and constructive partner, could indeed contribute to WHO and global health. Allow me to emphasize that the epidemic prevention and containment transcends national borders. Countries cannot fight COVID-19 alone. As the international community endeavors to strengthen mechanisms to combat COVID-19, Taiwan stands willing and able to collaborate with other countries and is playing an indispensable role in overcoming the pandemic. Taiwan, being granted full involvement in WHO and observer status in WHA, would allow Taiwan to share its successful experience with the world more effectively, helping put an end to the pandemic as quickly as possible. Mr. President, the best thing we can do to prevent future outbreaks is to strengthen health systems everywhere. Leaving any one region or country out of the global health network creates a gap that undermines global public health safety. We should not allow politics to create a gap in the global prevention control network. Mr. President, in the light of these considerations, the Kingdom of Eswatini would like to reiterate our strong support for Taiwan's participation in WHO, including the observership in the World Health Assembly, based on the principles of professionalism, pragmatism, and leaving no one behind. I thank you.
Thank you, Minister. We will now invite Mongolia to be followed by Cote d'Ivoire. Mongolia, you have the floor, please.
Mr. President, Mr. Director General, distinguished delegates, I wish to start my short statement by thanking the WHO for guiding the member states in the fight against COVID-19 pandemic since early January. In particular, Mongolia thanks the WHO Regional Office for the Western Pacific, as well as the Country Office for the technical guidance and support in our efforts to effectively respond to the pandemic. Colleagues, Mongolia reported its first confirmed case of COVID-19 on March 10. Since then, we have had total 98 confirmed cases, all been imported. Thankfully, we have not experienced localized community transmission as of today. The government has been implementing international travel-related restrictions to control initial cases to prevent from the outbreak of localized clusters of infections through active surveillance, testing, contact tracing, and quarantine measures, supplemented by social distancing rules. The preventive and containment measures are still in effect, and this bought us more time to prepare for the outbreak of the disease. We have been working to prepare our hospitals for the surge of patients that would require intensive care beds in case of large-scale community transmission. Yet we still face shortages of supplies of biomedical and personal protective equipment, especially N95 respirators that are essential for frontline healthcare workers. Recently, the government of Mongolia has conducted a 3-day simulation exercise at the initiative of the Prime Minister of Mongolia to test our national capacity for health emergency preparedness and response. The simulation exercise helped us identify areas that need improvements and draw recommendations from the lessons learned. Mr. President, from the global developments, it's very clear that substantial domestic as well as international public resources should be mobilized for long-term investments in health system preparedness and strengthening as guided by for the future vision of the Western Pacific region. Distinguished delegates, the COVID-19 pandemic has stained all health systems in the world without distinctions. From the global developments, it's very clear that we would still be sitting on a hot stone until the world has a vaccine to prevent infections and drugs to effectively treat them. As a developing country, Mongolia would like to request the WHO and other health partners to reform their commitment to the research and development related with finding vaccines against COVID-19 and make them accessible for the low and middle-income countries to ensure that no one is left behind. Thank you for your attention.
Thank you, Minister, for your intervention. We'd like to invite now Côte d'Ivoire to be followed by Venezuela. Côte d'Ivoire, you have the floor.
Madam President, the World Health Assembly is being held this year in an unusual format because of the pandemic linked to COVID-19, which is affecting the whole world and having an impact on our social habits. Côte d'Ivoire, since the first confirmed cases of COVID-19 on the 11th of March 2020, the government has mobilized and has developed and implemented a plan for sanitary response and a plan for economic, social and humanitarian support. Under the guidance of the President of the Republic, His Excellency Alassane Ouattara, strong and urgent measures have been taken. We have released significant financial resources in order to give an impetus to the response with an appropriate sanitary system in order to provide humanitarian assistance to the most vulnerable sectors of the population and to support economic activity. To date, my country has registered 2,061 confirmed cases. Of these, 987 have recovered and 25 have sadly died. Namely, we have a recovery rate of 47% and a mortality rate of 1.2%. Since 21 April 2020. No positive case has been registered outside of Abidjan, the epicenter of the disease, which had 98% of the confirmed cases and which was subject to lockdown to stem the spread of the disease. Madam President, solidarity and unity will be key for an efficient global response against this pandemic. For this reason, Côte d'Ivoire calls on member states of WHO to ensure the availability and accessibility for all countries of drugs and necessary medical equipment and the medical equipment required to fight this disease. Because of the harmful consequences of this pandemic, guidelines must be issued at the international level in order to allow developing countries, including those from the African region, to ensure the necessary budget for the response to the virus. Madam President, I pay tribute to all those who have died as a result of this disease, and I wish those who are sick to recover as quickly as possible. I would like to encourage all the health staff the world over and express on behalf of my country the wishes of unity and solidarity. We will defeat this pandemic. I would like to thank all the partners, in particular the UN partners. I thank you very much, Madam President.
Monsieur le Ministre.
Thank you, Minister.
Right now, Venezuela, to be followed by Guatemala. Venezuela, you have the floor. We will come back, and now we want to move on to Japan. Your Excellency, you have the floor. Thank you, Japan. Your Excellency, you have the floor.
Yes, this is May I speak?
Yes, please, Your Excellency, we hear you.
Dear Mr. Chairperson, today I would like to make 3 points. Firstly, Japan has been promoted from early on epidemiological investigation and social distancing policies to reduce the spread of the virus. Meanwhile, observing the increase in the number of cases, Japan has declared a state of emergency on every province to implement some measures, including asking people to refrain from going out, except where absolutely necessary. The number of the newly infected patients per day has decreased. Thanks to people's cooperation with such measures, that the social distancing policy has started to be gradually relaxed on May 14th. From now on, it's critically important to steadily implement the executive strategy to enhance the testing scheme and the healthcare delivery system, as well as supplies therapeutic drugs and vaccines. Secondly, I'd like to comment on Japanese contribution to the global strategy against the COVID-19. $76 million to WHO's SPRP, $96 million to CEPI, and $100 million to Gavi. I sincerely hope that Taiwan will be used effectively to bring an end to the pandemic and improve the people's lives in affected countries as soon as possible. Sadly, I would like to express my request for WHO. The impact that this pandemic has had is immense. I would like to address the need for impartial, independent, and comprehensive evaluation to review WHO's response, as well as to identify the source of the virus and the root of the transmission to prevent the next pandemic. Moreover, it is critical to correctly mobilize all the information and knowledge available in the world to tackle the COVID-19 and to save as many lives as possible. It also has been pointed out that the solution should be given to regions which successfully embrace the COVID-19 in terms of public health response, such as Taiwan. As being in a position responsible for public health measures, I would like to state we should not live on geographical vacuums in addressing the global health issues, such as infectious disease control, which will serve the purpose to prevent the spread of infection in each country and worldwide. I want to end my remarks by reiterating that the government of Japan will continue to make every effort to put an end to this situation in collaboration with each member state and related region and organization. Thank you, Chair.
Thank you, Your Excellency. We would now like to invite Venezuela to be followed by Guatemala. Venezuela, you have the floor.
Thank you, Madam Chair. Greetings to all the delegations. Until yesterday, Venezuela had 541 confirmed cases of COVID-19, 290 active cases, and until now we've managed to maintain a flattened epidemic curve, a morbidity of 17 and mortality of 0.3 cases per million inhabitants, with a recovery rate of 45%. 98% of the cases have been asymptomatic or with very light symptoms. In the last week, we've seen an increase in the number of cases coming from Colombia, Brazil, Peru, Ecuador, and Chile, and thousands of Venezuelans who are returning to the country because they're not receiving any social or health protection. Around 80% of the new cases come from these fellow countries. In Venezuela, we created the Presidential Commission for the Prevention and Treatment of COVID-19, directed by the President of the Republic, Nicolás Maduro. The plan develops in two phases. The first, before the appearance of cases, in which we set out a massive campaign of prevention with a flowchart of decisions, and we strengthened epidemiological surveillance and identified and prepared health centres. And in the second phase, when we had two first cases, we declared a health emergency and took drastic measures with quarantine, the use of masks, social distancing, the prohibition of large gatherings, suspension of activities, and massive testing and personalized testing through a test, which led to free access of tests and diagnosis and treatment. All of these actions have been carried out despite our major economic difficulties. It's necessary to repeat our denunciation of the crime that is committed against the people of Venezuela through the coercive unilateral measures that have held at ransom our people and have held more than $30 billion. In Venezuela, we've had our bank accounts frozen in the United States and Europe, which has created a great deal of difficulty for access to food and medicine. We would like to thank the WHO, PAHO, and the United Nations system, China, Russia, Cuba, and Iran for the cooperation on a humanitarian front. And we would like to end by congratulating Dr. Tedros Adhanom for the extraordinary management of the organization during the pandemic. Thank you.
We would like to now invite Guatemala to be followed by Mali. Guatemala, you have the floor.
Director General, ministers and delegates. The response to COVID-19 in Guatemala has been a unified effort led by our President, Dr. Alejandro Guaymate. Two months after taking power and through his medical knowledge, he brought together all the resources and capacities to provide a suitable response for health, security, food and financial resources, providing full support to actions for prevention, containment and mitigation to protect the population and support the development of the country. In this battle, we are aware of the deep necessity to protect our human resources in health. And faced with the shortage on a global level of equipment and supplies for personal protection, we called for the unconditional support of the Pan American Health Organization. We consider it's very important to include all stakeholders in the fight against the pandemic, as well as in the prevention of illnesses, highlighting the valuable and efficient work of the Republic of China, Taiwan, which has been developed on a global level, both in the current crisis as also in previous situations. Therefore, my country has called for its participation as an observer in the World Health Assembly, as well as at meetings, mechanisms and activities of the organization. Guatemala would also like to thank the government of Taiwan for the cooperation it has received with this humanitarian crisis brought about by COVID-19. We consider that Taiwan is a strategic ally in the area of health, and we stand by them. At the same time, I would like to thank extensively the government, and I'd like to pass on the thanks of the government and people of Guatemala to our friends and states and the international organizations who have supported us in our battle against COVID-19. Thank you.
We would now like to invite Mali to be followed by Dominica. Mali, you have the floor.
Permettez-moi avant tout propos.
Thank you, Chairman. First of all, on behalf of the President of the Republic of Mali, I would like to address our sincere thanks to the World Health Organization for its leadership provided to us through its Director General, Dr. Tedros. Despite having a very difficult security situation already in our country, when the pandemic reached us, we began by emphasizing prevention, the adoption of social distancing and barrier measures under the leadership of our President. He has already chaired 2 meetings of the Supreme Defense Council focusing on COVID-19. For us, this is a major security as well as a health risk to our country. Thus far, Mali has 874 confirmed cases, 52 deaths, and for the purposes of quarantine, we have requisitioned hotels so as to limit the spread. Approximately 1,000 of our compatriots have been repatriated, tested, and placed in quarantine in these hotels as a result of the operation of a humanitarian transport corridor set up and run by the Malian government. We have also embarked upon a wide-ranging response program with support from the WHO and the international community, which has helped us to the tune of 52 million euros. In fighting this disease, we are working in close cooperation with CDC Africa too, in order to improve research, contact tracing, and identification of those who are positive for COVID-19. We have an awareness campaign called One Malian, One Mask, which is organized inter alia, free of charge distribution of masks to the people. We welcome the solidarity and resilience shown by our population on a day-to-day basis as we fight the coronavirus pandemic, and we commit ourselves to continue to support them and increase that support. Our President has recently announced a credit line of 750 million euros to help us tackle the social and economic impact of the pandemic. Chairman, ladies and gentlemen, Mali, like all other African countries, needs testing equipment and PPE, respirators and ventilators. The fight against COVID-19 will demand the collective efforts of the entire world, and we will contribute to that. However, what COVID should not make us forget at the same time is that we need to fight other things as well, such as HIV, AIDS, diabetes, malaria, tuberculosis, and we need to keep up with our immunization campaigns. In conclusion, may I appeal to all the member states of the World Health Organization to mobilize so that Gavi can have its resources fully reconstituted at the forthcoming session on June the 4th. Thank you for your kind attention.
Merci, Monsieur le Ministre.
Thank you, Minister.
Inviting Dominica to be followed by Nicaragua. Dominica, you have the floor.
Can you hear me?
Yes, please go ahead.
Okay. Madam President, the Commonwealth of Dominica joined other delegations in congratulating you on your election to the chair of the proceeding of the 73rd World Health Assembly. We are confident that you will preside over this assembly with the efficiency and dedication required to make us through this period of global health uncertainty. We thank the Director General for his leadership and his commitment to promoting cooperation among all nations in the face of this global pandemic. Excellencies, ladies and gentlemen, the world as we know, it is facing an unprecedented crisis. COVID-19 has underscored the importance of a united approach by all peoples in the interest of all humanity. Prior to our first case of COVID-19, the government of Dominica, through its Ministry of Health and Wellness, implemented preparedness measures to educate our population of the novel coronavirus. Dominica recorded its first case on March 22nd, 2020. At its peak, Dominica recorded 16 cases of COVID-19, all of whom have since recovered. Our main focus was the prevention and containment of transmission, which was done by aggressive case identification exercises, testing and isolation, together with public health and social measures, all done to avoid an extensive mitigation stage. We continue to recognize the major role played by our healthcare providers and support staff. For this, we pay special tribute to them all. The Commonwealth of Dominica takes this opportunity to express its sincere gratitude to the government and people of the People's Republic of China for its significant contribution of medical supplies and equipment. China remains a true friend to small island developing states in our fight against this pandemic. The Commonwealth of Dominica joins the World Health Organization in recognizing that there is but one China, and the Commonwealth of Dominica is therefore supporting the peaceful reunification of all of China. I would also like to thank Bolivarian Republic of Venezuela and the Republic of Cuba for their much needed assistance and technical support at a time when all countries are battling the same epidemic and face similar challenges. As we continue to share the experience of COVID-19, The world should emerge better prepared for future infectious diseases. This will strengthen not only our national health system, but the World Health Organization as well. It is of paramount importance that we focus on the equitable aspects of healthcare internationally and the achievement of universal health coverage. The importance of striking a balance between maintenance of livelihoods and economic activity while preserving our health status and gains made so far is a delicate one. More so as local economies and borders are reopened in a phased manner. All of this being done based on the scientific evidence available. Let me take this opportunity on behalf of the people of the Commonwealth of Dominica to say special thanks and again commend the World Health Organization for the continued strategic technical support in containing this pandemic. The government of Dominica applauds the positive efforts of the Director General of the World Health Organization and his staff in providing the leadership, guidance, and coordination in the fight against COVID-19. The Commonwealth of Dominica takes this opportunity to record its deepest condolence to all citizens, families, and friends worldwide who have lost loved ones due to the COVID-19 pandemic, and urge all nations to remain united towards the fight against COVID-19. I thank you.
Thank you, Minister. We would now like to invite Nicaragua to be followed by Tonga. Nicaragua, you have the floor.
Hello.
Yes, we can hear you. Please continue.
Very much. Madam President, receive a warm greeting from the people and government of Nicaragua as we continue to build a society and reconciliation and always help. Exercising a sound in accordance with this reality, formulated a strategy to confront COVID-19, strongly preventive, like all of the rapid family and community health models. The first case of COVID-19 arrived in Nicaragua on 18 March. 2 months before, on 21 January, the Ministry of Health held a press conference informing the population of the impending threat in preventive measures. With the full declaration of public health emergency on 30 January, the government formed an interinstitutional commission to ensure a comprehensive approach. The 9th of February meets is supported by the S issued a full protocol to ensure surveillance, detection of suspected and confirmed cases, guaranteed prognosis, medical care, reduction of complications and mortality. The protocol also designated units in 19 hospitals to be specialized, or an increased respiratory symptom preparation and primary clinics nationwide, training of public and private sector personnel, and the acquisition of protective equipment. Nicaragua also has had an experienced contact tracing technique in place. The arrival of the for the first case in the 18th of March, with extensive preparation over a period of 2 months. Over 40,000 international travelers completed the 21-day visit. Over 350,000 educational household visits were completed by 98,000 health volunteers.
Honorable Minister, I do apologize. We cannot hear you well at all any longer. I would like to invite.
We also have continuing expanded programs to achieve sustainable development goals, especially for education coverage.
Thank you very much, Minister. We would now like to invite Tonga to be followed by Kenya. Tonga, you have the floor.
Honorable President and distinguished delegation, First, the Kingdom of Tonga wishes to thank WHO for all support and strong leadership by Director General Dr. Tedros and WHO WIPRO Regional Director Dr. Takashi Kasai. We appreciate the on-site financial and technical support by WHO Country Office, partner coordination and Pacific tailored support provided through Joint Incident Management Team for the Pacific countries in Fiji Sub-Office, Regional Office. Weekly information sessions with ALDI WIPRO, guidelines developed and information shared by WHO headquarters, which was adapted to the Tongan context, and also procurement of items especially for testing kits and PPE. So far, Tonga remains COVID-free, and we are working on a policy document for opening of the border with strict facility-based quarantine, strengthening contact tracing and case management, and engaging the community. Tonga is taking this adversity as a moment to strengthen health system and already established and strengthen one community health center to be a COVID treatment center and strengthen lab capacity to be able to conduct PCR testing. Community support has been tremendous, and community are engaged and are more aware of infection prevention control, including the importance of hand washing. I would like to remind everyone that this is the year of the nurse and the midwife, and my thoughts are with them and frontliners staff supporting those who are in need and saving lives. I am sure together in solidarity we can all get out of this stronger. Finally, I wish to thank WHO and partners for continual support for COVID-19 response and beyond, tailored to the Pacific and small island countries like the Kingdom of Tonga. Thank you, Malo Aupito.
Thank you, Honorable Minister. We are now inviting Kenya to be followed by Sudan. Kenya, you have the floor. We will move directly to Sudan. Sudan, you have the floor to be followed by the Central African Republic. It seems that we will go directly to the Central African Republic to be followed by Mauritania. You have the floor. We will move to Mauritania to be followed by Jamaica. Mauritania, if you hear us, please go ahead, you have the floor.
Bonjour.
Bonjour, Votre Excellence.
Good evening, Your Excellency. The floor is yours.
سيدتي الرئيسة.
In the name of God, the Merciful and the Compassionate, Chairman, ladies and gentlemen, Ministers of Health, and distinguished Assembly, and Dr. Tedros, WHO Director General, our greetings and may the blessings of God be upon you. I'd like to congratulate you, Chairman, on being elected as President of the work of this 73rd World Health Assembly. This session, as we know, is taking place at an exceptional time when the world is facing a major health and social and economic challenge with a pandemic which is affecting every aspect of life. This is obviously a very difficult situation, and if we are to tackle it, countries need to show solidarity. That's really the only way of tackling and overcoming the COVID-19 pandemic. I'd like to take this opportunity to convey my condolences to the families of all the victims of this pandemic around the world. I'd also like to take the opportunity of this meeting to put on record our acknowledgement of the crucial role played by doctors, nurses and health workers everywhere around the world. They are doing extraordinary things to alleviate the suffering of patients, to keep the number of deaths as low as possible, and to protect and preserve the health of those who are under lockdown or in quarantine. Today, it's clearer than it's ever been that the health sector is a strategic sector, one which should be recognized as such and one which should be strengthened. That's essential if we are going to continue to meet public health crises head-on. Ladies and gentlemen, since the very beginning, the Islamic Republic of Mauritania has had a national strategy to tackle this illness based on prevention and capacity building. Our aim was obviously to limit the spread of the virus and the risks that that spread brings with it. In doing this, we have followed the guidance given by and the directives of the President of Mauritania. Furthermore, we have adopted strategies which we hope will improve the outcome of our fight against the pandemic. That's the only way, as we know, of protecting our people and bringing down the level of infection in the country. The sound, however, this from the interpreters, has deteriorated and it's very difficult to hear the speaker now. As I was saying, we have set up a solidarity fund, the purpose of which is to make our control measures more effective and to ensure that they meet the needs we have while observing the necessary standards to be kept in hospitals, clinics, care centers, etc. As I said, we have a rapid response plan that's in operation.
But you have exceeded your time limit. We would like to ask you to conclude. Thank you very much. Appreciate your understanding. We would like to invite Central African Republic to be followed by Cameroon. Central African Republic, you have the floor. We will try once again Cameroon. please, if you can hear us, you have the floor.
Madam President, the Republic of Cameroon has the honor to speak on behalf of the African group in Geneva at this historic virtual session of the 73rd World Health Assembly. The African group acknowledges the efforts of the European Union and its member states in proposing this resolution and hereby confirms our wish to join as co-sponsors. The African group believes that the resolution is timely and addresses pertinent issues which member states are currently dealing with as they respond to the pandemic. Over and above that, the resolution symbolizes the outcome of multilateralism and unity of purpose to defeat this common enemy. Madam President, while the COVID-19 pandemic is primarily a health crisis, it has also had far-reaching implications on all sectors and spheres. The African group acknowledges that if drastic preventive and control measures are not taken urgently, the economic, social, and even security consequences of the epidemic could be felt on a very large scale. Africa is particularly at risk, given its relatively fragile health system, concomitant epidemics, limited resources, and high population mobility, among other vulnerabilities. Given these challenges, many of our countries follow the global trends and impose lockdowns to varying degrees. Approximately 70% of our population rely on subsistence livelihoods, and this therefore calls for adaptation of the lockdowns to local realities, challenges, resources, and strengths. To caution the most vulnerable from the effects of these lockdowns, our respective governments have provided targeted assistance, including through direct cash transfers and delivery of care packages and food parcels, for example. In order to coordinate our continental response, the African Union adopted the Africa Joint Continental Strategy for COVID-19 with the overall aim of limiting transmission of the virus and minimizing harm through the use of an all-of-government approach. These efforts are being led by the Africa CDC, working in close collaboration with African Union member states, the WHO regional offices, and other stakeholders. Madam President, the COVID-19 pandemic has shown that the world is safer and more secure from global health threats posed by infectious diseases when all countries are able to prevent or mitigate the impact of outbreaks, rapidly detect outbreaks when they occur, and respond effectively to limit their spread. At the moment, there is no vaccine or proven treatment available for COVID-19. As such, public health interventions will continue to be an important tool to reduce transmission and prevent further spread of COVID-19. Similarly, transparency and access to information are regularly done by the WHO with member states, including through regular briefings, remains key to the effectiveness of the global strategy against the pandemic. With regards to research and development, the African Group welcomes the various initiatives aimed at ensuring equitable access to new COVID-19 diagnostics, treatments, and vaccines. We join calls in support of developing mechanisms to ensure that when a safe and effective vaccine is developed, it is produced rapidly at scale and made available for all people in all countries at the cost that everyone can afford. History has taught us, as witnessed with disease such as HIV and Ebola, for example, that we cannot afford to leave anyone behind as a result of on equal access treatment. In this regard, we urge member states and the private sector to work together to facilitate the transfer of technology and know-how for medicines, vaccines, diagnostics, and other commodities that will allow us to meet global demand. No one country can do this alone. Where possible, member states should fully utilize the flexibility contained in the TRIPS agreement and the Doha Declaration to safeguard public health. Madam President, several African countries stepped into the COVID-19 pandemic under the United burden, which offers them limited room for fiscal maneuver to overcome the economic impact of the pandemic. We therefore call for a global coordinated with the debt burden by providing debt relief, including debt cancellation coupled with emergency
Ambassador,
grants.
please conclude.
In conclusion, Madam Chair, the African Group in Geneva wishes to reaffirm our confidence in the WHO under the leadership of its Director General, Dr. Tedros Adhanom Ghebreyesus, in the execution of its mandate as the United Nations lead technical agency for global health governance and public health emergency response. We also reaffirm our commitment to multilateralism.
Thank you, Ambassador, for your statement. We would now like to invite...
Thank you, Madam President.
Thank you, Ambassador. We would now like to invite St. Vincent. St. Vincent, you have the floor.
Can you hear me?
Yes, please. Please proceed.
Delegates of the World Health Assembly, greetings from St. Vincent and the Grenadines. The world is dealing with the most serious public health challenge in living memory. The COVID-19 pandemic has basically affected every corner of the globe with impacts on health and the economy. It is affecting lives and livelihoods. I never thought that I would see pictures of an empty JFK airport, the UK in lockdown, and health systems the world over under siege. But that became our reality in the 21st century. Right now, we are all basically marooned in our own countries. This pandemic has taught us that we don't have a developing world and a developed world or anything like that. We have one world, and we are all in it together. St. Vincent and the Grenadines has not had any cases of COVID-19 for over 14 days since May 3rd. We have had 17 confirmed cases overall, of which 14 are recovered and 3 are active. There have been no deaths and no health worker has been infected. In response to COVID-19, St. Vincent and the Grenadines implemented a raft of social and public health measures to minimize the spread of the disease. It is impossible to recite all these measures in a 2-minute statement. However, our strategy can be summed up in a few short lines. 1, finding cases and isolating them. 2, taking special precautions with high-risk groups, such as travelers and exposed persons, because they might be cases. 3, providing appropriate clinical care. 4, applying general and specific infection control and prevention measures as guided by the science. Fighting COVID-19 is like fighting a fire. We must go after it aggressively and snuff it out. We never had to resort to full-scale lockdown. We didn't impose curfews or close our borders and airports. Naturally, travel activity was curtailed by the suspension of commercial flights. We built our response on the foundation of public trust through advisories and appropriate actions. We have been managing risk with the aim of maximizing the health, freedom, rights, economic, social, and other benefits to the population. Our response was affected by the disruption of supply chains and trade restrictions. It took us 2.5 months to get a PCR machine, and even the International Atomic Energy Agency, for all its good intentions and explosive might, seemed powerless to help us on this matter. This raises many certain questions. Fortunately, we were able to do tests at the Caribbean Public Health Lab located in a nearby country using regional security aircraft for transportation of samples. We had to deal with complex matters such as the repatriation of Vincentian cruise ship employees who were abroad.
Honorable
This
Minister,
process is
we would
ongoing.
kindly ask you to
We thank
conclude.
God for everyone who came to our assistance, our development partners, the Caribbean Development Bank, the International Monetary Fund, the World Bank, and the United Arab Emirates stood by us. Cuba sent doctors and nurses for our isolation center. Venezuela provided supplies and rapid test kits, even though that country is still being subjected to sanctions and political adventurism at the time of COVID-19. Imagine that. Taiwan has emerged as a shining example to the world in terms of response to COVID-19 and has provided assistance to many countries, including St. Vincent and the Grenadines. But it is still locked out of the World Health Assembly. Imagine that. This matter must be addressed and resolved in a satisfactory
Honorable
manner.
Minister, we
In
would
the
kindly
interest
ask you
of
to
global
conclude.
health. Taiwan can help. The Director General of the World Health Organization is fond of saying that the antidote to COVID-19 is national unity, global solidarity, and the human spirit. I agree with him. We are in tempestuous seas, but we could summon to our assistance the following refrain from a popular song of faith in our country. With Christ in our vessel, we could smile at the storm. We will beat the coronavirus pandemic together. We are looking forward to the development of vaccines.
Thank you very much, Honorable Minister. We would now like to invite Jamaica to be followed by Tuvalu. Jamaica, you have the floor.
Third World Health Assembly, colleagues, good morning. On behalf under the guidance of the WHO, Jamaica's early response to the COVID-19 epidemic and our proactive approach to preventing, detecting, containing, and responding have resulted in significant slowing down of the disease in the country. We have, in fact, up to this point, flattened our curve. The strengthening of Jamaica's capacities under the International Health Regulations 2005 has been the background against which the country has responded. Our success so far has centered around an early education program, enhanced surveillance, early institutional restrictions, early response to perceived threats, and a rapid containment exercise. The resulting increased public awareness and early detection of cases and our primary healthcare establishment enabled us our ability to mobilize our response teams into communities for case investigation and contact tracing. Our experience in contact tracing, fast responses to public health emergencies such as measles and malaria have resulted in the continued elimination of diseases from our country. We can say that it is our early implementation of these measures from the detection of our first imported case that have had positive results. As a country, we have had to take drastic decisions to shut down sections of the island in order to conduct investigations and to contain this disease. The slowing down has also allowed time for the building of additional capacity in the health sector. COVID wards have been established and healthcare workers have been sensitized to the necessary infection prevention and control measures. We have increased the capacity for high dependency and mechanical ventilator support and care, as well as improved our inventory management of personal protective equipment. There has been significant strengthening of the lab and increase in the capacity to collect samples through the parishes. We want to thank the Pan American Health Organization and the WHO for the assistance that it has provided and continues to provide to Jamaica in this area. The acquisition of immunity, whether through vaccine or through exposure of the population, is a main consideration when contemplating the lifting of restrictions that will result in increased numbers of persons becoming infected with the virus. There are several uncertainties around the development of it. In conclusion, as we move forward, I would like to recognize and thank the hard-working healthcare workers of Jamaica while recognizing that this year, 2020, is the year of the nurse and midwife. Indeed, frontline workers worldwide are contributing tremendously in managing this pandemic. We salute these persons, Madam President, who are our true heroes. Thank you very much.
Thank you very much, Honorable Minister. We would now like to invite Tuvalu to be followed by the Central African Republic. Tuvalu, you have the floor.
President Director General, Dr. Tedros Adhanom, Excellency, ladies and gentlemen, I'm pleased to give this statement on behalf of Tuvalu. As of today, Tuvalu remains COVID-19 free. Our thoughts today are with our nations that have and still continue to fight the spread of COVID-19, and our prayers with the families of those who have lost loved ones to this novel virus. On this International Day of Nurses and Midwives, we thank you to those at the front line of international effort to minimize its spread, especially health workers around the globe. Since the end of January, with our Prime Minister at the helm, Tuvalu has been preparing for the possibility of COVID-19 reaching our beautiful shores. We have been working hard to strengthen our system so that we are ready. This has included mobilizing multi-sectoral coordination through a national planning and response task force and 7 subcommittees, improve surveillance and risk assessment, prepare our laboratory to test for the virus, maintain essential clinical management and healthcare services for our people, strengthen our infection prevention and control mechanisms, institute non-pharmaceutical public health measures, and disseminate risk communication via email, radio, TV, social media, and national press conference to keep our community informed, work with partners to investigate safe modes of transportations for medical supplies and operational logistics. COVID-19 is a wake-up call to developed countries and developing countries of the need to investigate, including training human resources for public health. Tuvalu support global research in findings and producing safe vaccine that will assist our recovery to becoming a COVID-free, 19-free world again. Thank you to the World Health Organization for your leadership and support. We know this has been an immense challenge. We especially thank to Dr. Kasai, Western Pacific Regional Director, for rallying your team behind us.
Thank you, Minister. I now give the floor to Central African Republic to be followed by Iraq. Central African Republic, you have the floor. Okay, so we'll need to come back to Central African Republic. I now give the floor to Iraq to be followed by Palestine. Iraq, you have the floor. Okay, so we will need to come back to Iraq. I now give the floor to Palestine. Palestine, you have the floor.
الأوضاع الصحية للسكان في دولة فلسطين. لا يزال النظام الصحي الفلسطيني.
Thank you, Chair. The Palestinian healthcare system faces a number of challenges during the Israeli occupation, and the population of Palestine faces a serious financial crisis. and it must also face the economic and political blockage and the blocking of villages and camps, as well as a piecing of the nation of Palestine, and they have to contend with the wall of separation and an increase of the colonization and settlement of the lands within the territory of Palestine itself. The citizens of Palestine are also subject to aggressions every day from the occupiers and the settlers, and many citizens of Palestine is estimated at 12.7 million, and 4.8 live in Palestine, so it's a proportion of 38.4%. The healthcare system in Palestine is made up of 5 major sectors: the Ministry of Health, then the agency and the military services, as well as the private sector and civil society organizations. In terms of the spread of COVID-19 in Palestine, we can say that all of the healthcare services have been mobilized in order to provide free treatment to all Palestinian citizens. We have had 548 confirmed cases in Palestine, and that is in Gaza Strip and in Jerusalem. Of these cases, they were in workers on the Green Line or people in contact with these workers. 67% of patients have recovered and were able to leave the lockdown. We have set up a treatment protocol, and we adopted all the necessary guidelines in the subject, and we've had close links with all our international partners, and we have been respecting coordination as a whole on a bilateral and multilateral basis with our partners. Palestine is today suffering under the occupation, and that is why we call on the WHO and all the member states to continue to provide support to Palestine so that we can provide the necessary healthcare to our citizens. Thank you.
Thank you very much. We would now like to invite Gavi, the Vaccine Alliance, to take the floor. Gavi, you have the floor, please.
Thank you, Chair. The COVID-19 pandemic threatens years of progress in primary health care. In Gavi countries, over 70% of the target vaccine introductions and campaigns for 2020 have been delayed, suspended, or are at risk. We are faced with an emergence of other vaccine-preventable disease outbreaks, such as measles, yellow fever, and polio. The pandemic will disproportionately impact women, vulnerable, marginalized communities, as well as zero-dose children, those who do not receive any routine vaccine. As an alliance built on the principle of equity, Gavi is taking urgent action to support countries to maintain and restore their immunization programs. We are also part of the WHO ACT Accelerator, co-leading the work to achieve global access to COVID-19 vaccines. Gavi has 2 specific asks for you. First, to support and call for a fully funded Gavi replenishment on June 4th. This will be critical to our work with countries to immunize children, implement the Immunization Agenda 2030, save lives, reduce poverty, and protect the world against the threats of epidemics. Second, to support global access to COVID-19 vaccines. COVID is a global problem, and we need a global solution. A vaccine is the best hope for the world to get back to some semblance of normalcy. We need to get the best science in the world for vaccines and make sure those vaccines are available to everyone, for no one is protected until everyone is. Finally, Gavi would like to express profound appreciation for the works of health workers, nurses, and midwives for their extraordinary dedication and service to humanity. Thank you.
Thank you for your intervention. I would like to give floor now to the International Federation of the Societies of the Red Cross and Red Crescent, to be followed by the International Atomic Energy Agency. IFRC, you have the floor.
I'm a nurse and a public health delegate with the Australian Red Cross, and I'm speaking today as a member of a global network of 14 million volunteers and 500,000 staff from across 192 national Red Cross, Red Crescent societies. COVID-19 poses the greatest threat to our collective health and well-being. The work that Red Cross, Red Crescent does every day to support programs in maternal and child health, vaccinations, HIV, malaria, the disabled, and accessing clean water and sanitation are threatened by this global pandemic. We know people living in poverty don't have a stockpile of food or money to help them through any form of lockdown. We know that it will highlight and exacerbate inequalities in all contexts. Those that were vulnerable, marginalised, excluded and stigmatised before this pandemic will disproportionately feel the force of its effects now and well into the future. Collectively, we must do all we can to protect those most vulnerable, and we must ensure that we deliver on our promise of health for all. We must also look to the indirect consequences of this outbreak on our already overwhelmed health systems. For many, it's their only point of contact with life-saving health and routine care services. People will still require their antiretroviral medications, food supplies must continue to flow, expectant mothers must have a safe place to give birth, malnourished children still need access to feeding centres and support, and communities will still need to access safe water and sanitation. We therefore call on states to do the following: continue to invest in essential humanitarian work and fragile health systems, a collective global commitment to designate and ensure access to everyone, irrespective of where they are in the world, in any future vaccines, testing and treatments for COVID-19, and ensure a duty of care for all those public health professionals, first responders, community health workers and volunteers responding to this outbreak. Thank you.
Thank you very much. I would now like to invite the International Atomic Energy Agency to be followed by ITU. IAEA, you have the floor.
Distinguished President, Director General, the IAEA is an important partner for countries battling the COVID-19 pandemic. We have focused on providing practical guidance and equipment for detecting the virus. We are supplying nuclear-derived diagnostic kits and accessories to 242 laboratories in some 120 countries. We produced webinars and videos for healthcare and laboratory professionals, including on sample collection and processing. We have received generous contributions from member states. The relevant cooperation project is now the biggest in the history of the IAEA. Our long-standing partnerships with WHO and FAO have proved immensely valuable. We are actively participating in the COVID-19 crisis management team. At the next IAEA Board of Governors meeting in June, I will set out my ideas on how the agency can best support member states in responding comprehensively to future pandemics. More generally, let me note that the IAEA is very active in the human health field, helping member states to address challenges such as cancer, cardiovascular diseases, and malnutrition. Our particular focus is on radiotherapy and nuclear medicine. We greatly value our cooperation with the WHO in all these areas. Thank you.
Thank you, Your Excellency. We would now like to invite ITU to be followed by UNOPS. ITU, you have the floor.
Congratulate WHO Health Assembly. As the UN specialized agency for ICT technologies and services, and a longtime partner of WHO, ITU is committed to continuing to leverage ICT technologies to help defeat COVID-19 and make the world safer, stronger, and more connected. Never before has digital health and ICT technologies such as artificial intelligence, cloud computing, Internet of Things, 5G, and others being so fundamental to economies and societies everywhere. Now, more than ever, universal health coverage will be possible only when everybody is connected. I'm confident we can use the momentum around COVID-19 to bring digital health solutions to billions and transform today's digital revolution into a development revolution for all.
Thank you, ITU. We would now like to invite UNOPS to be followed by UNCTAD. UNOPS, you have the floor.
Pandemic and measures to contain it are hitting the poorest and most vulnerable the hardest, risking the progress made on nutrition and achieving the Sustainable Development Goals. The pandemic is already increasing hunger and malnutrition because for many of the 61 member countries, a day without work means no income and no access to nutritious food. Many are pushed deeper into poverty and essential health and nutrition services are disrupted. Nutrition is key to build immunity, protect against illness and infection, support recovery and build resilience. Malnutrition is an underlying cause of almost half of child deaths and negatively impacts children's cognitive and physical development. I call on all stakeholders to ensure that malnutrition is adequately addressed in the COVID response and recovery through a multi-stakeholder approach.
Thank you very much, Your Excellency. We would now like to call UNCTAD to be followed by UNAIDS. UNCTAD, you have the floor.
No country has been spared by COVID-19. Beyond the tragic death toll, the pandemic has cut millions of jobs and livelihoods, especially in developing countries with fewer safety nets and resources. Global production and trade have plummeted in the wake of unprecedented confinement measures. We expect global trade to fall by a staggering 27% in the second quarter. This crisis has shown that we need better trade, not only as an engine of economic growth, but also to tackle shortages of medical supplies and food. Solidarity and cooperation are crucial to find solutions to this crisis and overcome the shockwaves on debt, food and migration, particularly in the developing world. Let us use this opportunity to craft development strategies for a better recovery, which is more fair, more resilient, and protects our environment.
Thank you, Your Excellency. We would now like to invite UNAIDS to be followed by UNFPA. UNAIDS, you have the floor.
President and ministers at the Assembly, Director General, my brother Tedros, distinguished delegates, I speak on behalf of the joint United Nations program on HIV/AIDS. As we have seen with HIV, and as we now see with COVID-19, epidemics affect everyone, but they do not affect everyone equally. To fight COVID, we have to fight inequalities because pandemics feed on and widen inequalities. That is why I'm backing calls by over 100 current and former world leaders and global experts to unite behind a people's vaccine. Together, we want all leaders to guarantee that when a safe and effective vaccine is developed, it is produced rapidly at scale and made available for all people in all countries free of charge. We unite behind a people's vaccine to protect all of humanity.
Thank you very much, Your Excellency. we will now go back to our member states, and we invite Central African Republic to take the floor, to be followed by Nicaragua. Central African Republic, you have the floor, please.
Il faut faire vite. Je parle devant ou pas? C'est ça, c'est ça. Oui, oui. Ils attendent. Madame la Présidente.
Madam Chair, Vice Chairs, Ministers of Health and Delegates, Director General. The Central African Republic aligns itself with the statement made by Congo on behalf of the African states members of the WHO and would like to add to that. In the name of the government and the people of the Central African Republic, we'd like to congratulate the Director General of the WHO for his proactive leadership. As you are aware, the Central African Republic is a low-income, landlocked country which has suffered from several decades of political and military conflict and instability, which has led to a crumbling of the health system as well, and as a consequence has the second highest toll of maternal mortality and epidemic outbreaks where children have paid the highest price. And added to that, we have porous borders which lead to transmission across borders. And this context of extreme fragility, the pandemic of COVID-19 is a threat to the health of mother and child. Since the detection of the first case on the 14th of March, and the setting up of the response by the high direction of the President of the Republic, we have seen that we have an epidemic which is characterized by a rapid increase in the number of cases imported and local cases. On the 18th of May 2020, we had 366 confirmed cases, 13 recovered and 0 deaths. With a very limited capacity, we must stop this rapid progression of the epidemic to avoid the worst. So this is an opportunity for us to issue a call of help to the WHO. And so the CAR would like to congratulate the WHO for setting up a large number of partners for the platform for essential supplies to combat COVID-19. And we haven't yet received these supplies. And without the donations of a private Chinese foundation, we wouldn't have been able to carry out our response. So we call humbly on the WHO and its partners to be more attentive to the conditions of fragile countries in this battle. The way in which data seems to be worth more than that which we give. The rapid, flexible approach of the contributions. In particular, the WHO, UNICEF, the MINUSCA mission, France through Pasteur Bangui Institute. These have been essential in helping us to set up the testing campaign. Thank you for listening.
Thank you, Your Excellency. I apologize for announcing Nicaragua. We already heard their statements. Now we go to Benin. Benin, you have the floor.
Madame la Présidente, Monsieur le...
Thank you, Chairman. Chairman, Director General, ladies and gentlemen, Benin, like other countries in the world, has been affected by the COVID-19 pandemic. We had the first case registered on the 16th of March. In trying to cope with the pandemic, we have taken social distancing measures, we have imposed the obligatory wearing of masks, and we have limited people's movements. We have a cordon sanitaire around our capital and our major urban areas that was put in place 40 days ago. We are now gradually opening up our lockdown that began in the 11th of May. The people of Benin, like the government, are committed to continue with our response measures and follow WHO guidance. We would like to underscore the importance of continuing to ensure that the greatest possible number of people have access to tests and diagnosis, and that means having rapid testing kits available in our regions where there are not many laboratories. We would also draw the attention of the international community to the need to work in order to make access to drugs and treatment easier, and that's also true for the medical equipment required to respond to COVID-19. We are grateful to WHO and our other technical and financial partners for their assistance. It is very much appreciated. We urge that developing countries continue to be given support in their efforts to tackle this situation. Thank you very much.
Merci, Monsieur le Ministre.
Thank you, Minister.
With international organizations, I would like to invite UNFPA to be followed by International Organization for Migration. UNFPA, you have the floor.
Colleagues, friends, in welcoming this World Health Assembly's focus on COVID-19, UNFPA wishes to express alarm about the pandemic's impact upon women and girls. Access to life-saving sexual and reproductive health services is under threat as resources are diverted and global supply chains are disrupted. Reports of sexual and gender-based violence are sharply increasing, just as prevention and response services are strained. Nevertheless, we are rising to this extraordinary challenge, including in humanitarian situations. Our support to countries with weak health systems helps maintain sexual and reproductive health information and services for women and young people. It helps prevent and respond to sexual and gender-based violence, including a halt to child marriages and female genital mutilation. And we are assisting with protection of health workers, including midwives, so no woman dies while giving life. With such sustained investments in the face of the pandemic, we can indeed build back better and attain health for all and all the Sustainable Development Goals. UNFPA stands proudly with the World Health Organization and all our partners, with governments, and with the people we serve on the ground in over 150 locations, confident that after COVID-19, we emerge stronger and together deliver a healthier future for women and girls and everyone everywhere.
Thank you for your patience. This morning when we began our session, I proposed a very ambitious course of action. There were many delegates who took the floor and made statements. However, given the hour, I propose that we suspend this item and take any further speakers tomorrow. Tomorrow we will also consider the draft resolution. However, before closing the session for today, I would like to now give the floor to those delegations that requested to exercise their right of reply earlier in the day, or would like to make such requests now. I would like to kindly recall my earlier requests that in delivering a right of reply, delegations be as brief as possible, taking into account that at this meeting, interventions themselves are limited to 2 minutes. If delegations could kindly interrupt the word brief relative to the time allotted for interventions, I would greatly appreciate that. And finally, if there are subsequent requests by delegations for additional rights of reply concerning the same matter as previous replies, may I kindly request delegations to limit such statements to 30 seconds or less. Again, I hope delegations will understand that these requests are made in our common interests in the good order of our proceedings. I shall now give the floor to China. China, you have the floor now, please.
Madam.
That's fine. Okay. You got them up.
Madam Chair, the Chinese delegation requests to exercise the right of reply in accordance with Rule 57 of the Assembly's Rules of Procedure. After consultations, all parties decided not to discuss Taiwan-related proposals at this virtual assembly so as to ensure its smooth proceeding. However, in disregard of this consensus, a few countries still made irresponsible remarks and unwarranted accusations on Taiwan-related issues, which seriously violated relevant resolutions of the UN and the WHO and undermined the global solidarity against the pandemic. China strongly protests and firmly opposes this behavior. China reiterates that the issue of Taiwan's participation in the activities of international organizations must be reasonably arranged and through cross-strait consensus under the One China principle. The Taiwan authorities refused to accept the One China principle. As a result, the political basis for its participation in the WHA no longer exists. Since the outbreak, the Taiwan region has been able to obtain relevant information and participate in necessary technical activities through cross-strait channels and arrangements made by China and WHO. The so-called gap in the international epidemic prevention in Taiwan region is a purely political pretext. Its real purpose is to create two Chinas, or one China, one Taiwan in the world. But this plot will never succeed. China urges relevant countries to pay more attention to contain the epidemic and save lives, shouldering their due responsibilities to their own people and to the international community. Confrontation and divergence will not prevail. Only through solidarity and cooperation can we overcome the pandemic. Thank you, Madam Chair.
I now give the floor to the United States.
Thank you, Madam President. Given the lateness of the Ambassador, I will briefly consider several U.S. concerns and will submit the entirety of our statement for the record. Regarding the United States again asked that this forum remain with technical exchanges of information related to public health and not one used for political agenda. However, given the earlier statement by Iran, the United States will exercise its right of reply. The United States has and continues to offer humanitarian assistance to the Iranian people to help address the coronavirus outbreak. The United States maintains broad authorizations, exemptions, and exceptions that allow for the sale of food, agricultural commodities, medicine, and medical devices by U.S. personnel working in the United States to Iran, and similar exceptions apply for foreign persons providing aid. Our sanctions are not an obstacle to providing humanitarian aid to Iran. Regarding Cuba's statement, the United States wishes to call out Cuba's appalling and egregious choice of words. Their reference to genocide is deeply offensive and dismissive to the victims of actual genocides that have occurred. For decades, the U.S. embargo on Cuba included broad exemptions and authorizations that permitted the sale and donation of agricultural products, medicine, medical devices, and other humanitarian supplies with billions of dollars of goods authorized for export to Cuba since 1992. Under this administration, all applications for licenses to send medical goods to Cuba have been approved. In 2019 alone, the United States exported at least $3.7 million of medicines and medical products. Regarding Syria's statement, the U.S. Syria sanctions program does not target the provision of humanitarian goods, including medicine, medical supplies, and food to Syria. The United States already provides exemptions and licenses for humanitarian aid and medical supplies to reach the Syrian people and has done so for many years, including U.S.-funded humanitarian aid to regime-held areas. The United States so far has provided more than $31 million in humanitarian assistance to Syria to counter COVID-19. This comes in addition to more than $10.6 billion the United States has provided in humanitarian support to Syrians since the conflict began. Finally, in conclusion, Madam Chair, the COVID-19 pandemic makes clear the urgency of engaging all public health authorities and the value of exchanging lessons learned in real time. As the WHO is charged with protecting our national global health, it is essential to include these authorities, especially those with first-hand experience in combating COVID-19. We ask the WHO to exercise leadership, independence, and inclusivity and fully involve Taiwan in the global COVID-19 response, including Taiwan's participation as an observer in the resumed 73rd World Health Assembly session. Thank you.
Thank you. Having come to the end of the session for today, I would like to thank you for joining us and remind you that the next plenary will reconvene tomorrow at 12 Central European Time. Thank you.